Welcome to today's myofascial moment. I have spoken with several people recently who are struggling with some significant back pain and neck pain that they just cannot get to ease. So today we're going to spend 10 to 15 minutes doing the exact things I do when my low back's troubling me or my left hip's troubling me. This is how I reset my own tension levels. This is what's helped a lot of people with their own self-treatment. We've got a blog article about it. Anyway, going to guide you through some things. So this position here is a modification of a constructive rest position. I do like to have my legs elevated. I do like to have them supported. Now, the constructive rest position I learned is just to have your feet on the floor with your knees bent. But I find for myself that requires a bit more muscular tension than I want to use as I'm actually trying to soften in my low back. So I like to lay flat on my back. I like to get my legs up on a chair. A couch will work, a low bench will work, a stool, anything you can get your legs up on and rest comfortably and let your body start to settle into the floor. Gravity is going to do the work here as your sacrum and your pelvis first start to settle onto the floor. Slow your breathing and start to quieten your mind. Bring your awareness, in particular if this is about back pain for you, which it usually is for me, bring your awareness to your pelvis, your sacrum, and your spine. Now, if you're in a bit of trouble, a bit of crisis, this can feel quite achy. It can actually feel quite scary to let your spine start to settle into the support of the floor. That's normal. When the back is in pain, significant pain, especially if it's a sudden onset or you tweaked it or you feel like you did something wrong, often it goes into protective spasm, which means everything gets tight to prevent movement because movement hurts. So as you start to soften, that can be quite achy or scary as that unclenching eases. But you want to spend a good 5 or 6 minutes here letting your body start to feel the support of the floor under you. This isn't something to rush. You might feel your neck start to soften and settle. You might feel your shoulders start to drop onto the floor. As you slowly breathe into areas of tightness and tension, you might feel gradual easing somehow that you might not quite be able to put words to, but that are an indication that spasm, any clenching, any protective bracing is letting go a bit. Again, this is a constructive rest position. There's nothing really here to do except soften in your body. You find this is somehow difficult for you, ask yourself the question, what can I do to support my body so that it can soften? It might be a towel or a pillow under your head. It might be a sheet or a folded blanket under your low back. It might be a lower chair. You might prefer your feet on the floor. Good myofascial self-treatment happens as you're curious about what your body needs in any given moment, as you're curious about what you're experiencing, as you're curious about the tension you're holding in your body. If anywhere's achy or sore, tender, as you're here, see if you can bring your breath and awareness into that area. Take a deep breath in. See if you can imagine that area expanding like a balloon. And then exhale. Let that tension drain from your body. Inhale again and imagine that area that's maybe tender or sore or tense, expanding like a balloon. And then exhale. And let that tension drain from your body. You might feel an organic, instinctive motion in your head or neck. You might notice Kaylee's body softening here even more. Let your arms fall to wherever they're comfortable. Your head or neck starts to drift. Your legs start to roll out. Don't get in the way of that motion. Let this be easy. Let this feel good. At some point, when you hit the 4, 5, 6 minute mark, it is likely going to feel like your body has softened into the support under you. If it hasn't yet, you might want to stay here a bit longer. Just hit pause on the video and stay here. But if this is feeling good, this might be all the self-treatment you need today. You can stay here. Stay here until you're ready to get up or until your kids need you, until it's time to get up from lunch. Whatever it is that's calling you, this might be as far as you can go today. When I'm dealing with my own back pain, the first thing I have to do is ease any protective spasms or cramping that's happening. So I like to start here. Now, if I'm going to continue with my own self-treatment, I then start to work with any sort of tension and tightness between the ribs and the hips. So I'm going to help Kaylee shift from here so she doesn't have to do too much. We're going to get her to take her legs off the chair. I'm just going to move the chair. We're going to move into a side lying position. Now, side lying is exactly like it sounds. I'm going to hand Kaylee a pillow. Usually, you want to fold this pillow in half. We're going to get Kaylee to face us. If she folds that pillow in half and puts it right under her hip, between her hip and her ribs, so that she's giving herself something to make an arc over. Yeah, about like that. So you want to lay down, support your head with your arm if you need to. Sometimes if you put your arm behind you, in front of you, you don't really want to be tipping here, but you also don't want to be using any muscular effort. So I'm going to help Kaylee again. The bottom leg's going to stay bent to support you, and then this top leg is just going to extend out. Now, that right arm might reach overhead with the left one eventually. This tends to feel like a really good stretch between the hip and the ribs. What you want to do here, back pain a lot of times, like I said, at least for me, happens when my pelvis gets kind of wonky. I've either sat a lot, I've walked a lot, I haven't been diligent about my self-treatment. So first my back goes into protective spasm. It starts to get hitched up on one side or the other. It starts to get a bit of rotation. These are the ways I reset those tension levels and start to stretch and open the myofascial tissues in a gentle way so that my body can settle differently, so it can self-correct in a natural way. So I start by easing the spasm in that constructive rest position, and then I get one side or the other. You probably will have a side that's easier to open through your side of your body first. Doesn't matter if you're using the right or the left side up first, but get into a side lying position, a rolled up blanket, a folded pillow, something under your side. I've used couch pillows before, throw pillows. Something under your side to just lift a little bit. Extend the top leg away from you. Then you might eventually, depending on any shoulder trouble, bring that top arm also overhead. Get a nice stretch through your side. Our hip and our ribs tend to get closer together than they should, or closer together than is ideal for good movement of the spine and pelvis. And this should feel like a good stretch. It can also feel achy in the spine or the low back, depending on your particular troubles. You never want to force into anything here. You don't want to be holding your breath. You don't want to be clenched in your body. Sometimes people need a bit of support under the knee of that extended leg if your knee gets kind of tweaked there. Never a bad idea to grab some extra pillows or blankets to support. Let this be easy. Let this feel good. At a minimum, it should instinctively feel helpful. Again, depending on your back troubles, it can be achy. Something that's good and helpful isn't always the same as something that's pleasant and 100% comfortable. Bring your awareness into the area between your ribs and your hip. See if you can start to expand that with your breath. Breathing in with a deep, full breath. Expanding that space between your rib and your hip. Exhaling, and letting any excess tension drain from your body. You might lengthen the leg away from you even a bit more, almost like an active stretch, but then let that muscular tension ease. That new layer. And this is gravity-based myofascial self-release. The body will have a natural stopping point, a place at which it feels, I've done what I needed to there. Whenever that point is for you, we're going to switch to the other side with this sort of deliberate self-treatment. For my own back pain, I do tend to self-treat both sides. Now again, this might be achy as you try to move. So normally, if this was me, I would turn onto my knees and then just turn and face the other direction. But since we're doing this for some instruction, we'll actually have Kaylee get up onto her knees and turn all the way around so her head's where her feet currently are and her feet are where her head currently is. I usually don't move this much when I'm doing my own self-treatment. I just turn over and I'd face the wall. So this is for you. As you move, do so in a way that doesn't cause you to brace or clench. Be gentle and be slow. There's no rush here with self-treatment. As you get set up on the other side, and again, fold that pillow, the towel, the rolled up blanket, whatever it is you have, under your hip. You want to be stacked fairly well on top of that, not tipped forward. You have your bottom leg bent so it can support that arm under your head however you need it, perhaps another pillow. Start to allow space to open between this hip and the ribs. As that gets easier, depending on any shoulder issues you might have, you might eventually want to take that arm overhead, but there's no rush to get there. Move just a bit and reset, so start to slow your breathing again. Quiet in your mind. Make sure your body's comfortable and feels supported. Imagine space opening between your rib and hip. Breathe into the entirety of your body. Breathe space into your spine, down through your legs. Slower and deeper, more full breath every time you breathe in and breathe out. Good myofascial release will never force, thus it will never injure. Always working with what your body allows, always working with what the tissues allow. As we engage into areas of restriction, with a sustained stretch or sustained pressure in a way that doesn't feel like threat, that is never force. It allows the body's protective mechanisms to ease and the tissues to begin to rehydrate and glide again. As you stay here and start to feel a sense of ease or space in the hip, you might want to deliberately reach your foot away from you just a little bit. Or reach your arm overhead just a little bit, making this uniquely your treatment. Listening to your body. Breathing into any areas of achiness as the spine and pelvis are asked to do something different here. Letting this be easy. And depending on the time you have, this might be where you stop. I have one more aspect that I use in my own self-treatment when I am particularly addressing back pain. I'll talk through it first. We'll let Kaylee be here a few more moments. So far, just to review, we've laid flat in a constructive rest position that allowed our spine to settle out of any protective bracing first. That can be achy. We rolled onto a side, put some support between the ribs and the hip, and opened through one side, asking the pelvis, spine, and ribs to orient a bit differently than they have been. Working with the other side now. The last thing I do is actually turn onto my stomach. I want to keep that pillow, but I tend to roll it really, really tight and put it right under my hip bones. Now, if you have a soft foam roller or you're using a blanket here, you can use whatever you want. But I want something under the front of my hip, almost that I'm going to just lay over, picturing my low back space opening. So I tend to roll this or fold this as tight as I can. And I just put it right under my hips. I want the bones right on this roll. I'm just going to lay over it, supporting my head on my hands. If your neck has enough space, you might want your neck to one side. You want to be comfortable. This is going to encourage that low back space to open just a bit more. Now, we do this sort of self-treatment in a lot of other standalone ways. This is a good way to finish any sort of self-treatment aimed at reducing back pain or opening space in the back. It's kind of a four-part self-treatment. Again, this can feel achy. But if you imagine you've got that support under the front of the hips, that space between the sacrum and the spine, the space right in your low back, is being asked by gravity to open just a bit. You breathe into that area. Imagine your breath is expanding the space between the vertebrae. Imagine your spine elongating. A little bit more space between each vertebra. Let gravity and the weight of your legs pull the pelvis away from the low back, creating a bit of space that way. There's nothing to do here. And then quiet in your mind. Slow your breathing. Let time and gravity do the work. It's not uncommon for me to feel a pop here as something actually resets. The body has a natural self-corrective mechanism. It's always trying to hold us upright, hold us together in the ways it best can. We're creating space here for the body to self-correct, to do its job well. And the body does tend to have a natural stopping point. I tend to stay in this position until I feel that natural stopping point. Kaylee might not be there yet, but when you are ready to move, again, move slowly and gently. I recommend wiggling in your toes, wiggling in your legs, coming up onto your hands and knees gradually, perhaps moving the pillow or blanket, whatever you have under your hip, exploring a little bit of cat and cow movement, a little bit of flexion and extension of your spine, just testing movement in a slow and gentle way. Testing out the space you have, feeling what's different. Now, if your back's been in protection for a bit, again, this can feel quite achy. You want to move slowly so you don't spasm in your back. Be curious about what you feel. You might sit back on your heels and reach forward with your arms and extend it that way, lengthening through the spine. You might twist or rotate a bit in your hips or shoulders. Be curious about movement here as you integrate change. You might find you want to go back to that starting constructive rest position. There's no right or wrong answer here other than forcing and trying to make your self-treatment look like someone else's self-treatment. Let this be easy. Let this feel good. Thanks for joining us. Send us any questions. Your body will thank you for some consistent, gentle self-treatment. We'll see you next time.